Okay, everyone, thank you so much for joining this evening. We are very excited to welcome you here to Birthing Baby Bonds, Closing the Racial Health and Wealth Gaps Through Policy in Washington State. My name is Anya Lewin, and I am the program manager of the Economic Inequity and Health program here at Washington Physicians for Social Responsibility. And yeah, very excited to welcome you here. I'll start by just telling you a bit about our organization as I multitask and let folks in. We have three programs which we feel represent the gravest threats to health. Those are nuclear weapons and abolition, economic inequity and health, and climate and health. And this event tonight is brought to you by our Economic Inequity and Health Task Force. In this task force, we envision and strive to create a world where all Washingtonians have enough money, all Washingtonians are housed, structural racism no longer creates health inequities. And we do so by taking action to provide a consistent health perspective to pass social justice policies that improve health, by building our community and changing social narratives about the root causes of health inequities, and deepening our understanding of economic and racial equity, health justice, and advocacy strategies. And with that, I would like to introduce you to our moderator for this evening's event, Dr. Rachel Chapman. Rachel Chapman is an activist and art-based professor of medical anthropology addressing race, class, gender, and labor and health justice. Her work illuminates processes of transformation and continuity, resilience and peacemaking, power and performance in oppressed communities, especially movements to end health disparities, state and intimate partner violence, and building racial and social justice in the world. So, with that, I would love to hand it over to you, Rachel. Thanks so much for facilitating our event tonight.
Thank
Thank
you,
you,
and
and
thank you
thank
for
you for
including
including
that.
that.
Am
Am
I
I
echoing in
echoing
your
in your
room?
room?
No, you sound great on our end.
Hmm.
I hear an echo.
Let me try resharing without sharing my audio. Maybe that will.
Check. That sounds better. Yeah? All right. Thank you, everyone. It is such an honor to be here. You can see my name is Rachel Chapman, and I will be your doula or midwife for birthing this baby bond discussion, which has some of the people who are the most engaged and passionate about this. I have been a member of WPSR, and I know I need to update my dues, but I've been a member of WPSR for the last 2 years, and it's an honor to unpack the rich discussion that we have for you tonight. I want to let you know how this will happen so you won't be surprised. Magellan Rankin will be introducing the topic, and I will be introducing her. We will then be going to a panel type discussion where everyone talks about some part of this issue. Please put your questions into the chat and we'll put them all together for the end. And then we'll have a section where we're asking one question of all the presenters and then an individual question to each of the presenters. So I hope that will bring lots of good information and passion to our discussion. The first person I want to introduce you to is Magellan Rankin. They is a dual NPH MSW student at Johns Hopkins University and the University of Maryland, Baltimore. While living and working in Washington State for almost a decade, they supported children and families through social service work in children's behavioral health and housing justice, while also conducting racial health stigma research. It's an honor to share this intro with you, Magellan, and Magellan's on the East Coast, as are some of our other speakers. So thank you for staying up with us.
Of course. Thank you for such an amazing intro. Hi, everybody. My name is Magellan. And I am one of the authors, along with others here, of the white paper that we are introducing here at this program, and setting the stage for why we're here. Um, uh, this project came about through all of our participation in the Economic Inequality and Health Task Force, and we all believe that baby bonds presents a unique bridge between economic opportunity and long-term health outcomes ultimately. Um, I think we all believe that they offer a promising approach to addressing the racial wealth gap while expanding opportunity for children born into low-income families across Washington state. Um, and yeah, we wrote this paper to examine baby bonds from multiple perspectives, but ultimately we view this policy as more than an economic intervention. Uh, it's a public health investment in our future. So that's why we're here. Um, Here is a graph of the US racial wealth gap from 2022, and it talks about um, family median net worth. And as we see, uh, that white families have a higher median net worth than Black, Hispanic, and other populations. And um, I like to think of this as like to ground this in the fact that like much of the wealth we see, like the 44,000 with Black families, is the price of like a brand new car, um, versus like the price of a house, as you can see in white families. So that's this graphic. And then I also uh, took this graphic from Tracy Yeung, who is also in this uh, talk and will be speaking later, but about home ownership in Washington. And as we can see, white families own more, like have the highest rate of home ownership, around 68%, while Black families also have the lowest. And then there's also a um, people of color um, bar too, where it's 51%, and this is all of them combined. So I thought this was really interesting. And so I wrote the parts of this paper where we contextualize the racial wealth health gap in Washington state. Um, could you? Thank you. And basically talked about past racist policies restricting wealth building opportunities for many Black, Indigenous, Latino, Pacifica, and other marginalized communities. Um, as we know, uh, westward expansion uh, created a lot of uh, disparity, such as land possession from our indigenous neighbors, as well as housing discrimination, redlining in major cities, as well as other places too. Even redlining can be seen even in rural communities, as well as economic exclusion that contributed to today's racial wealth gap. These structural inequities continue to shape wealth, economic mobility, and health-related outcomes across generations, as can be seen in chronic illness, poor nutrition, and a lack of accessible and quality clinical care. And so Baby Bonds invests in future generations' health outcomes by expanding access to wealth building opportunities. And that's why we're here too, to talk about that. And here is a video by Dr. Derek Hamilton, who explains what baby bonds is.
I'll do a brief introduction. If you're like me, you might have had lots of questions about how do we in real time start to close the wealth gap and how at the same time investing in future generations. We're lucky enough to have words of both the founders of this baby bonds movement. David Radcliffe is here, and Derek Hamilton, one of the founding director. He was the founding director of the Institute on Race, Power, and Political Economy at the New School. He's been involved in crafting policy proposals that have garnered media attention and inspired legislative proposals at the federal, state, and local levels, including baby bonds, guaranteed income, and a federal job guarantee. We're going to present you with a brief but spectacular take on building a birthright to capital.
The latest Republican spending measure is likely to undergo substantial changes in the coming days as it winds its way through the House. But currently, it includes a plan to give $1,000 to every baby born between 2025 and the end of 2028. It's an idea that was first proposed by economics scholar Derek Hamilton. Here is his brief but spectacular take on so-called baby bonds.
We have the ethos that if you just study hard, if you just work hard, if you just make great decisions, that one can accumulate wealth. Now, certainly, studying hard, working hard, astute decision makings are beneficial, but they are limited if you don't have capital in the first place. Growing up in New York City in the 1980s, I could see the differences between the people I grew up with in Bedford-Stuyvesant versus those who I went to school with. I had the privilege of being able to go to an elite private school, Brooklyn Friends School. The individuals in both of the environments, the love, the care, they didn't vary that much. But what did vary was economic circumstance and what that could afford people. The typical Black family has less than a dime for every dollar in wealth as the typical white family. In fact, when Black households acquire more income or more education, if you compare them to their white counterparts, the gap does not reduce, it grows. I am the founding director of the Institute on Race, Power, and Political Economy. Can you summarize what you're going to do in 2 pages? I'm a scholar and I'm a teacher. I love engaging with people over ideas, but it's not enough to do scholarship. It's not enough to have broad conceptions of how society works. We translate that into actionable policy. The idea around baby bonds is simply to ensure that every child has the benefits that's often exclusively reserved for the wealthy. Baby bonds are accounts that are seeded at birth, reserved by government until the child becomes of age, a young adult, and then those accounts are allowed to be used in wealth-building ways, essentially babies that are born into poverty as measured by Medicaid use. In July of 2023, the first baby to get a baby bonds in Connecticut happened. When they become 18 years old, that initial $3,200 will grow somewhere between $10,000 to $18,000, depending on how well the market does and how well those accounts are managed. And that child will be able to use that money to provide a down payment on a home, finance higher education, or start a business. People are not free if they don't have resource, if they don't have economic rights, if they don't have rights to capital. At the Institute, we're committed to building an economy grounded in human rights. We're investing in guaranteed income. We're investing in reparations. And guess what? It turns out it benefits us all. My name is Derek Hamilton. This is my brief but spectacular take on building a birthright to capital.
And you can watch more brief but spectacular videos at pbs.org/news.
Very inspiring. We thought it would be fun to take you to the streets with Derek and have that, especially the picture of him as a kid. So it turns out none of us are free until all of us are free. The next 2 people we are so lucky to have, we have all of the writers on the white page, on the white paper with us today. The next 2 folks I'm going to introduce are authors on the white paper. First, Josie Tracy. Josie is a PhD and a licensed clinical psychologist in private practice in the Seattle area with a specialty in treating substance use disorders. She's passionate about social justice, especially issues affecting people with substance use disorders and incarceration history. Welcome, Josie. Gleb Sych. I should have asked you before.
Sych.
Sych is a family medicine resident physician based in Olympia, Washington, with clinical interest in patient-centered, harm reduction-informed care and the impact of social determinants of health on patient outcomes. He is particularly interested in advancing equitable healthcare delivery models that address both medical and social needs to improve individual and community health. Welcome, Gleb. And if you didn't know what you wanted to be when you grow up, may you be very inspired.
All right. So thank you, everyone. I'll kind of just start off by taking us into like the heart of why baby bonds are not just an economic policy, but a public health intervention. One of the core focuses of our white paper is simple but profound, in my opinion. Wealth is a powerful determinant of health. As we wrote in the paper, wealth is the currency of health that enables access to the opportunities and resources necessary to sustain healthy, stable lives. That means wealth shapes whether families can secure safe housing, nutritious food, quality healthcare, and the stability needed to thrive. So why does wealth matter for research? So across decades of research, wealth consistently predicts life expectancy, chronic disease risk, mental health and psychological distress, and overall well-being. In fact, with people with the least wealth experience dramatically worse outcomes. One study that we cite in the paper found a 62% higher mortality risk among the least wealthy Americans, and another showed life expectancy gaps as large as 13.5 years between wealth groups. That's not biology, that's policy. In terms of structural barriers, these disparities aren't evenly distributed. As Magellan already touched on, structural racism in housing, lending, and land access has blocked Black, Indigenous, Latino, and Pacifica families from building wealth for generations. In Washington state, you can see this clearly in home ownership rates. 60% of white households own their own homes compared to just 33% of Black households. Home ownership is one of the primary ways Americans build wealth, and its absence directly reinforces these health gaps. So how does wealth improve health? So wealth does three critical things for health. It provides financial security. For instance, it helps families meet basic needs and weather short-term shocks. It builds long-term stability. Assets like home equity or savings create opportunity and buffer against crises. And then it reduces chronic stress. It lowers financial strain, improves psychological stability. It reduces depression and anxiety, and it supports healthier decision-making. If you can go to the next slide, these pathways are captured in a conceptual model that we created for this paper, where financial security essentially leads to wealth, which leads to reduced stress, which leads to future orientation, if an orientation towards the future, and improves your overall health. Now, obviously, this is a very simplified form of like our model here, but I think this gives a pretty good picture of how all these components play with one another. So what do baby bonds change? Baby bonds intervene at the structural root. By giving children from low wealth families an asset at birth, we're not just helping them pay for school or buy a home, we're altering the fundamental conditions that shape lifelong health. Modeling shows the impact could be enormous, up to plus 6 years of life expectancy gained for the lowest wealth groups, up to 4 years for Black Americans on average, and importantly, no negative effects for higher wealth groups. So if we step back, the big picture is this: wealth is health. When families have assets, they have stability, lower stress, and the ability to plan for the future. And those conditions translate directly into longer, healthier lives. Baby bonds are designed to create exactly that kind of foundation for children who have historically been denied it. So the next question is, does this kind of policy actually work in practice? So because baby bonds are still relatively new, we don't have enough long-term health data from these programs themselves, but we do have a rich body of evidence from similar asset building interventions around the world and in our own country. And those studies give us a really clear preview of what baby bonds can do. And I think that's a great transition to what Dr. Tracy will talk about.
Thanks, Dr. Sych. Um, Yes, so I think maybe just to clarify, because it can be a little confusing because there's lots of these kind of, well, not lots, but there are different vehicles for these child savings accounts out there, and baby bonds is one of them. There are a few states where they're enacted. Connecticut was the first. And we'll be talking more about like what it looks like in action. But you guys may have also heard about these. They're 530A, also called Trump accounts. Those are a newer type of. These are all called child development accounts. And there's one called 529. They're college savings plans, which you may have for your own kids that have, you've saved for going to college. Um, and so child development accounts, again, is kind of the generic term. They can be structured in a lot of ways, but some of what we used for our research in this paper relies on child development accounts because there have been studies both sort of implemented for the purpose of a study and also natural places around the world where they've done these child development accounts and studied them. They aren't always structured exactly like baby bonds, but we've used those as sort of a proxy for what baby bonds could do in terms in the health space. So one thing to know, just how a little bit about how these are different, is that it really matters like who gets the money, which babies get the money. And so when it's just indicated for low income children, that has the biggest impact on reducing the wealth gap and the racial wealth gap. If the enrollment is automatic, right, you don't have to opt in. That also increases the chances that people are going to be enrolled and be able to use it. And then if your contribution type is that the government contributes, but family contributions or personal contributions are not allowed, that actually helps reduce the wealth gap because then it's not just like the wealthy are getting wealthier by putting in more of their money in personal savings and investing. So eliminating that option really reduces the racial wealth gap. And so that's why you'll see those little green checks because this baby bonds, when it comes to like how it's structured, is set up in a way to maximize a reduction of the wealth gap and the racial wealth gap. Compared to Trump accounts and college saving plans, which have a lot of features that potentially can widen the racial wealth gap and the disparities between who gets them and who doesn't. And next slide, please. Thanks. So just to talk a little bit about the mental health pieces. Because we don't have baby bonds or newer policy, there is one randomized control trial in the works, but studies are short on this. We're looking at child development accounts as our best proxy. And what we have is we found both in the US and around the world support for baby bonds improving mental health outcomes. So in Oklahoma, there was a study called the SEED Oklahoma study, and they found that the socio-emotional development in toddlers increased and punitive parenting decreased, as well as maternal depression as a result of getting these child development accounts. In Uganda, there's several studies looking at vulnerable adolescents. Some have HIV, some have parents who died from AIDS, and so looking at folks that are kind of more vulnerable, they found that these CDAs or childhood development accounts have increased mental health and self-concept, and also decreased hopelessness and depression. And in Hong Kong, they studied low-income adolescents in more of a naturalized study. This wasn't a randomized control study, but it was something the government was already doing, and so they studied it. And they found that the people that opted in for these child development accounts had increased social support, increased social quality of life, increased school engagement, increased hope in reaching goals, and reduced behavioral problems. So those are the kids, the adolescents who knew that they were, going to be coming of age and getting these baby bonds. Okay, so takeaways we have just from our section here, and encourage you to read our paper to learn more. But basically, pre-existing in our country are significant racial wealth and health gaps in our country, with racist policy decisions at the root for like how we got to where we are. And that baby bonds have a really great potential to help correct for this and to really start to reduce these gaps. we have connections, strong connections in the literature that wealth is a core driver of health, and evidence both from these child development accounts and from simulation models, like looking at how baby bonds would work in the real world and finding support for baby bonds improving mental health, increasing lifespan. And then we assume, as Dr. Sych was talking about, with increased wealth, we should also expect to see physical health improve. So this is our plug for our white paper. Maybe we can drop a link in the chat for folks to visit, but it's a little more in depth. So if you liked what you heard today, you can read more about it, see our citations, look at our graphics, all those things. Thank you. Feeling the love. Thanks, you
Beautiful.
guys.
Thank you for that important. We're building a layer cake here. Josie, I wanted to ask just because I was trying to pay attention and I wanted to make sure that people going forward knew what RCT
Oh, yes, sorry. That is
stands
stands for a randomized controlled trial. And that in like the scientific literature is one of the more robust ways of studying something because you can actually get a peek into like cause and effect. And that's because when you have conditions, you can actually randomize who goes in those conditions versus like a natural study where maybe people opt into one program versus the other. And there might be other things you go, oh, well, that's because these people are more educated or these people are more whatever. And you can't really control for that. But these controlled trials try to help reduce all those extra noise, all that extra variable to really look at the thing that they're studying.
great. Thank you very, very much. And with that, I will use that bridge to introduce David Radcliffe. David grew up in a small factory town of Appalachian foothills in Western Pennsylvania. Today, he lives with his family in Connecticut. Professionally, David is the state and local policy director at the New Schools Institute on Race, Power, and Political Economy. Previous work experiences include policy director of the Office of Connecticut State Treasurer, where he championed implementation of the first in the country baby bonds wealth building initiative, policy analyst at the Federal Reserve Bank of Boston, and grassroots community organizer. He has a strong passion for working with people to build places and economies where everyone can live happily, fulfilling, prosperous, and productive lives. Welcome, David, and thank you for bringing us Connecticut to the West Coast.
You bet. Thank you, Rachel, and all for having me. I will make sure I have this pulled up here. Um, there we go. So I know it is a bit late in the day, but I'm going to test you. What do you see on the screen there? Can anyone tell me what that is? Put in the chat if you're reluctant to speak out loud. It may look like a baby, but this is not just any baby. This is a super baby. And Nolan, born 3 years ago, just a few weeks ago, was and is the first baby bond baby in America. And what that means is, through no choice nor fault of his own, Nolan was born into a family under poor circumstances. And it also means, because he was born in Connecticut on July 1st, he is automatically enrolled to be a Connecticut baby bond baby. And what that means is the state of Connecticut invests $3,200 on his behalf in a master trust account that's managed and invested by the state treasurer of Connecticut, and with investment earnings grows to between $11,000 and $24,000 that young Nolan can use for one of four wealth building activities upon young adulthood. And that can be putting it into a home in the state, putting it into a small business in the state, retirement security, or whatever might follow high school. So training, trade school, college. And those are four research-based activities that tend to put one into a wealthier position. Now, we don't know Nolan specifically, but we do know that no matter how hard he or his family works, no matter how much he or his family community love him, that because of the circumstance of his birth, that he will likely start behind and stay behind a range of outcomes, economic, health, and otherwise. And this intervention is meant to sort of help young Nolan and his counterparts, of which 50%, incredibly, in Connecticut, one of the wealthiest states in the country, are born into similar circumstances, get a better start in life. This graphic might help sort of grounds when we talk about wealth. Where does that sit in sort of the domain of surviving to thriving? So as I walk through this graphic, think about you or someone you know or love or don't love, to someone in your world, someone you serve and support, want to do well. Most of the time, policy focuses on helping people survive, and that's really important. And we need to be doing even better at that. And if surviving is represented by a refrigerator, these are things we access on a daily basis. So income is a flow of resources that we need to live our lives, to afford the goods and services we need to hopefully do okay in the current moment. Income is often in the form of wages in exchange for labor, or things like the child tax credit or direct cash programs, Social Security or public benefits. Flow of resources so that we can afford our lives. Now, the basement in the middle represents, well, there are spiders, of course, and cobwebs, and the income that comes in, sometimes it goes back out to pay other people for debt that we may have accrued through medical debt or student loans or payday loans. Debt is a constraint on the resources that are coming into our home. On the other end, and this is where we want to be, we have a large pantry, so everyone crowd in. If income represents a flow of resources, wealth represents a stock of resources so that we can weather economic shocks or get through a pandemic, to have something to fall back on in the event we might lose our job. For many people, wealth comes in the form of an inheritance or trust fund, or potentially equity through home appraisals and so forth. What we are talking about with baby bonds is to invest in young people who don't have the benefit of those resources. And at least 50% of Americans don't have them. So the idea of baby bonds is to democratize wealth so that everyone can have access to it. And that gets us through this continuum from surviving to thriving, to getting by, to getting ahead, from having insecurity to security, the things that wealth can bring us. So again, baby bonds. Connecticut, 3.5 million people. We're 3,000 miles from you all. One of the wealthiest states per capita in the country, but also significant economic insecurity, one of the more racially and economically segregated states in America. 50% of births are covered by Medicaid, and that was the measure that was included in the policy that passed 3 years ago now, where 50% of births are automatically enrolled in this baby bond program. And so it's about a $50 million price tag a year that the state puts in. That's about 16,000 births times that $3,200 startup seed capital. And then, as described previously, it's used for one of those four wealth building activities. And since Connecticut has passed this poly, it's been pretty exciting to see the interest and momentum. And first of all, understanding the role that wealth can play in not just economic security, but in community security. And so there are 20 states that have introduced or are considering baby bond style legislation. There are also 10 baby bond pilot projects that have popped up in 9 different states, red, blue, and purple. And those pilot projects are represented by those yellow pins. And there's Washington. Look at you all. You're colored green there. You got a little pin going, and still work to do. But this is a big, bold policy. And it's not something that will happen overnight necessarily. But we feel like there's a moment and a window where there's more progress possible. I wanted to sort of double tap on one of the pilots, which is pretty interesting, and it relates, I think, directly to this relationship between health and wealth. The state of Vermont, led by the state treasurer, introduced a baby bond bill several years ago, has tremendous bipartisan support, 80 legislative co-sponsors, House and Senate, and passed but without funding. And one of the bits of feedback that the treasurer had from elected leadership was that this sounds amazing, baby bonds. We should have done it 20 years ago, and you forget about it now. But the reality of folks on the ground is that folks are struggling in the moment. And as incredible as baby bonds is, it doesn't put food on the table, doesn't pay the light bill. So can you, state treasurer and community leaders, think of an experiment where we could learn about a potential blending of family-focused investments that we could get to eventual scale and public funding. So what Vermont is developing is this cool initiative that is focused on the top three most impoverished counties called the Northeast Kingdom in Vermont, up by the Canadian border, with a significant poverty in a rural context. And the proposal is this, it's called the Maternal Health Super Bundle. And what's pretty sweet about this is it's anchored by a baby bond, so a similar $3,200 startup investment that's managed by the state treasurer. It also combines these other investments that each on their own have an evidence base. And the idea is that if we do them together, we could supercharge not only family economic security, but better maternal and infant health outcomes and other benefits that you could imagine. So, in addition to baby bonds, there's a provision of diapers to the National Diaper Bank Network. There's a direct cash provided third trimester into the first 15 months after birth to help so weather the most expensive time of a young baby and young family's life, and then a maternal health supports provided by the Yale evidence-based practice called the Moms Partnership. And this is initially philanthropically funded, so private funding, although managed largely by the state treasurer, and it's launching in early 2027, and it will be evaluated by the Urban Institute. And the interim and longer term outcome measures are pretty cool because it's not just the economic benefits that we're looking for, but what are some of those nearer term effects around hopefulness and reducing anxiety and stress and other things that are really important for family and community well-being. In this baby bond universe, at the Institute, we convene folks from around the country who have sort of the gleam in the eye of baby bonds, and then like how do we win on the eventual policy and all the hard work in between. And we started in June along with the Aspen Institute and the Urban Institute convening what we call a national community of practice. So we have cohorts of leaders from the 12 states in yellow, including Washington. There you are. So that's pretty sweet. And we're excited to be on this journey together. And what's neat about this mix of states is that it's coast to coast, like literally, and heartland states, and red, blue, and purple. And it really represents not only the interest, but I think the opportunity that folks see in this solution for people in their states. This was already addressed, but I think it's worth a double tap just to note that 530A accounts are part of what passed in last year's so-called One Big Beautiful Bill. These exist and launched officially this past July 1st. And for babies born between July or January 1 of last year and the end of 2028, there's $1,000 seed funding that's available from the federal government into accounts that are opened up by parents and caregivers. And from a distance, and if you squint, you say, "Hey, that's pretty cool. That sounds kind of like baby bonds." There are some major differences, though. They address different problems in different ways. And I think that the headline differentiator is that the baby bonds are really focused on endowment, on a trust, a substantial seed capital to get young people on their way, versus 530A accounts, which are a close cousin to 529 college savings plans, are savings accounts. And that's pretty good if you have the ability to save. And as noted earlier, if you're in a position where you don't have that sort of discretionary income, these accounts may not serve you as well. And we can talk more in the Q&A if if you're interested to hear more about the risks and opportunities and challenges that these bring. So I am rounding third base. So some of what we've been learning in this space in the past several years, from these pilot projects to state and federal action, is that and you all seem pretty clear-eyed on the challenge that you want to address, and being also clear on the distinction between income and wealth, which isn't always evident or clear, and so just being clear on the issue that you all trying to solve really matters. Now, you all have already told some extraordinary stories about, what it's like to be born in poor circumstances in your state. What does the data say about that? What does that mean and point towards in terms of life outcomes, not just health, but economics, involvement with the justice system, access to housing, and all the things. And then how you talk about it matters. There are words and languages that can be engaging and others off-putting. So just being really strategic about your messaging and narrative can be useful. Thinking about, this does have a price tag to it, as do all important things that are investments. So being thoughtful about what might be some durable funding sources, revenue sources is important. And also thinking about the return on investment. And we are hosting on August 12th, if you haven't had your fill of baby bonds tonight, some researchers from Johns Hopkins. So Magellan, glad you're in the Johns Hopkins families, are working with the Connecticut State Treasurer to do some simulations to show what is the return on investment for Connecticut baby bonds in two dimensions, at least initially. One, additional state revenue, and also a Medicaid savings. So the out year benefit of return on investment. And the early returns, I've seen some of the modeling, is very powerful and compelling. And that might be a useful thing for you all to think about. Like, would that be useful to help with case making in Washington State? And some of these things are evident that it's helpful to have a big tent. That is really exciting that you all, with the Washington Physicians for Social Responsibility, are banding together to shine a light on the need and value of this sort of investment. And think, who else might you need to have the muscle you need to win on this? And a lot of work that Tracy and others have been doing over the years has been really building that tent. But just to reinforce that, you could imagine a diverse set of actors who would have a self-interest to see baby bonds successful in Washington State. So think about mayors, Ds and Rs. Think about chambers of commerce. Think about housing advocates, labor, faith, all these interests who really make up your communities and could be useful allies as you're driving this work forward. And certainly philanthropy, hospitals, healthcare, long list of potential partners in this. If you pursue a pilot, think carefully about how that gets you to policy. While pilots can be super helpful, we don't want just endless high quality pilots, but we want to get to eventual scale and public funding. And then two, I don't think any of us are pretending that baby bonds will solve all the world's issues, that this is part of a larger suite of family focused investments. So without affordable quality health care and childcare and access to quality healthy food, this is an incomplete picture. So we need to think about not an either or, but an all. And here I am. There's home plate. I'm sliding into it. As Derek mentioned in the video, which is so cool to see, hard work, income, and education are so critical, but they are no longer enough in these times to afford the American dream. And the difference often, as Derek mentioned, is that the lack of access to capital. And while we want high quality programs, we cannot program our way out of poverty, although individuals can system wide set up in a way that makes that very difficult. Sorry, literally getting choked up. Nor can we save our way out of poverty. Hold on one second. There we go. A little better. Volume. And we cannot save our way out of poverty because there are deep structural issues that are set up to exclude certain groups, often on purpose. And you can read the rest there. I'm losing my voice. The bottom line is that baby bonds can be framed as a pro-opportunity investment that promotes economic vitality, family support, and engagement in really profound and powerful ways. And there's another cute baby to end. This is Zayden and his awesome mom, Leslie, as part of the New Mexico Baby Bond Pilot Project. And we want to see many happy, smiling Washingtonian babies upcoming conversations. So with that, I stand down and thank you.
Thank you so much, David. That was so much great information. And I see a lot of love coming in, flowing over to you all on the East Coast. I was thinking when you were talking about birth work organizations, I'm in collectives of birth workers across the state of Washington. And while only about 24% of Washingtonians receive Medicaid, for birthing families, over 53% of Black birthing families and over 64% of Indigenous families are receiving Medicaid or have in the past, which means that would affect a huge number of the families who, and I'm going back to your idea of super bonds, in those two communities, maternal mortality has doubled over the last 10 years, which means that something really terrible is happening in terms of resources. So the things that you talked about really that include mental health and maternal mental health really it impacted me a lot and would have a huge impact on the state of Washington. Our next author and expert in the area of baby bonds is Dr. Tracy Yeung. Tracy is a senior policy analyst at the Washington State Budget and Policy Center, where she's been since 2020. Prior to her current work, Tracy worked at the Chinese Information and Service Center as a family caregiver, support specialist, and in-home care case manager, serving low-income, limited English-speaking, and elderly immigrant families in King County. Tracy has a Master of Public Health from the Community-Oriented Public Health Program at the University of Washington. Tracy, welcome. So glad that you're here with us.
Thank you so much for that introduction, Rachel. And I think you gave me an accolade that I have not earned, which is doctor. But thank you for that. I am so excited to share with you all tonight about the work on baby bonds in Washington State, which we call the Washington Future Fund. So I'm just going to dive right in. And I want to start with a very quick high-level overview of how our legislative process works, because I will talk about how baby bonds legislation has moved in our state over the last few years. And so very quickly, a bill or legislation that gets introduced to the legislature has to go through all of these steps to become law. It needs to have a hearing and a vote in a policy committee. So it could start in either the House or the Senate, or it can move through both chambers at the same time, which does speed up the process. But after it's voted, if it's voted out of the policy committee, then it needs to go to a fiscal committee. In the House, that's the Appropriations Committee, and in the Senate, that's the Ways and Means Committee. If it gets a hearing and is voted out of the fiscal committee, then it goes to the floor for a floor vote. So that means all the representatives, all the senators are voting on it. And if there is a majority vote, then it'll move to the other chamber. So it needs to be voted off both the House and Senate floor, and then it goes to the governor's desk. And that is my quick 1-minute overview. So baby bonds, or the Washington Future Fund, was first introduced in Washington in 2022. So in 2021, Connecticut passed their baby bonds legislation, as David shared, and then our state treasurer heard about that amazing work, and he wanted to bring it to Washington State too. So the Washington Future Fund is agency request legislation by our state treasurer. He has been an amazing champion for baby bonds since 2022. And this first iteration of the bill was a $3,200 investment, similar to Connecticut, for every baby born in Washington that receives Medicaid, and could be withdrawn between the ages of 18 to 30 and used for post-secondary education, home ownership, and entrepreneurship. And the numbers, this was in 2022, but the numbers are pretty similar even today. So the impact is really large. It would reach about 40,000 babies. That's half of all babies born in the state. And Rachel, you were just talking about those racial equity impacts. And just looking at the most recent numbers, over 70% of Indigenous and Hawaiian Pacific Islander and Hispanic babies are born and receive Medicaid. So there is a really huge racial equity impact with baby bonds. So what happened in that first year? It was heard in the House and Senate policy committees and passed out of both policy committees. So that was a really great start. It was really exciting. Unfortunately, that was as far as it got, and the legislature instead funded a wealth inequities study to look at the wealth landscape in our state. And it also established the Washington Future Fund Advisory Committee to provide recommendations to effectively and sustainably implement the program. So the study wrapped up, the committee provided recommendations, and those recommendations were adopted in new legislation that was then introduced in the 2023 to 2024 legislative sessions. And there were a few changes, but I'm just going to highlight two here that are bolded. You can see the initial deposit from the state got bumped up from $3,200 to $4,000. And then the time to withdraw the funds was also increased. It was 18 to 30, and then it got increased to 18 to 35 years. And that just allows more time for the young person to think about how they want to use their funds, and allows more time for the funds to grow in the accounts if that's what they want. And then similarly, this bill was heard in both policy committees in the House and Senate and passed out of the policy committees, but did not get any hearings in the fiscal committee. So that was as far as it got. So then in 2025, we pivoted and thought about a Washington Future Fund pilot. We introduced a pilot instead and imagined what it would look like if we had invested the funds in a baby bonds program 18 to 35 years ago. And now the babies have grown up and they are young adults and they can use this fund. And so the pilot was designed as $25,000 grants to 40 young people across the state aged 18 to 35 years old and used for those three purposes, those wealth building activities of post-secondary education, home ownership, and entrepreneurship. And this bill actually was heard in the Ways and Means Committee, so that's the Senate Fiscal Committee, which was the first time it had kind of gone that far to be heard in a fiscal committee. And that was really exciting. Unfortunately, that was as far as it got. It didn't get a vote out of Ways and Means to the Senate floor. And that kind of is just kind of stalled after that. So that brings us to now and to the future. What's next for baby bonds? And I want to just talk about some challenges and opportunities ahead for us. So the main challenges, as I'm sure everyone is aware of, is our state budget deficit and then federal cuts from HR 1 on top of that. So our state has faced multi-billion-dollar deficits in the last two budget years and very likely will face another one in 2027. There's lots of reasons for that, but I'll just sum it up to increasing costs to maintain current programs due to inflation and increasing demand for our state services and supports, which are really important, such as long-term care, childcare, and the Working Families Tax Credit. And we also, maybe most importantly, have a deeply systemic issue to how we fund our state budget and services. We have a very outdated upside down tax code. It is largely unchanged from almost 100 years ago. And it asks people with the lowest incomes to pay the most in taxes as a share of their income, while the wealthy few pay the lowest rates. And this is mostly because our state over relies on sales taxes. It makes up about 50% of our state revenue. And sales taxes is not capturing a lot of the wealth that's in our state. So what's happening is that the amount of revenue the state has been bringing in over the years is falling behind relative to all of the economic growth that we're seeing in our state. And then lastly, the federal cuts from HR 1 last year will require our state to spend billions of dollars to backfill those programs. And the Kaiser Family Foundation estimates almost 40 up to $46 billion over the next 10 years in Medicaid cuts alone. But that also provides us with many opportunities, and I want to talk about building coalition power first. David just talked about building a big tent, and I think that is one of the silver linings of this moment that we're in is there are so many more organizations and individuals coming together that typically wouldn't have before, and seeing more of that connection between folks in doing economic justice work, health justice, and racial justice. And I think that in this event alone really shows that we are more and more people are seeing that we are connected. There's a through line through everything that we are advocating for. It's not all siloed. We can't be siloed anymore. So I hope, everybody here tonight will join our coalition, will advocate with us for baby bonds. And if you have ideas and other people in your network, other organizations that you believe would be great to join in our baby bonds coalition, please don't hesitate to reach out to me. Another opportunity is to build more philanthropic partnerships. In this moment when our state is not able to provide the public funding, we can lean on our philanthropic partners to provide resources to fund pilots. As David said, like we can't just stop there, but we can use the results from pilots to go back to the state to show the evidence for why it's such an important investment, why baby bonds are such an important investment and good use of state dollars. And then lastly, this is a great opportunity to really show why we need more progressive revenue. We can't fund baby bonds unless we also advocate for more progressive revenue. And I'm sure most folks know that we passed a millionaire's tax this past legislative session, which is really amazing and exciting. There's also a lot of work to do to make sure that we can protect it. But it's not the end all be all of progressive revenue, and it won't solve all of our budget problems. And thankfully, there are a lot of other options on the table still, such as a wealth tax and high earners payroll tax, closing loopholes in our capital gains tax. And I know that WPSR has been an amazing member of the Balanced Tax Code Coalition in advocating for a more progressive and balanced tax code. So now I want to pivot. I know Josie and David have both mentioned or both provided comparisons of baby bonds with other child development accounts, including the 530A accounts, also known as Trump accounts. But I will just do a deep dive into a comparison between the Washington Future Fund and the 530A accounts. And the high-level takeaway that I have for you all is that the Washington Future Fund would provide better financial opportunity than 530A Trump accounts. So I'm going to go over the 6 high-level components of each of the programs. That's the purpose, eligibility, the initial deposit, additional contributions, and then also fund management and automatic enrollment. So for the purpose, the Washington Future Fund is really designed to be a publicly funded trust account for wealth building purposes. And this advances economic justice by providing the seed capital to populations that have been historically excluded from policies that help families build wealth. On the other hand, the 530A accounts are essentially individual retirement accounts for children. They actually become traditional IRAs at age 18 and are subject to IRA withdrawal rules. So this emphasizes individual responsibility in saving for retirement without considering the systemic barriers to wealth building. In terms of eligibility for the Washington Future Fund, it's for every baby receiving Apple Health before their first birthday. So it's really targeted for these babies and families with fewer financial resources and ensures public funds reach children who are furthest from financial opportunity, which helps ultimately to reduce the wealth gap, including the racial wealth gap. On the other hand, 530A accounts are for any child under age 18 with a Social Security number. It's untargeted, meaning that children are receiving the same investment regardless of their family's financial status. The Washington Future Fund provides $4,000 in contrast to the 530A accounts, which only provide $1,000, and that $1,000 is only for children born between January 1st, 2025 to December 31st, 2028. The Washington Future Fund doesn't allow additional contributions, which Josie explained, so I won't go into that. And 530 accounts do allow up to $5,000 in contributions from families and employers. And at a 6% return, the accounts that receive $5,000 in contributions every year are projected to grow to over $157,000 in 18 years, while accounts with no additional contributions will have just about $3,000. And the Washington Future Fund is managed by the State Investment Board. So this removes the need for families and individuals to navigate the financial system. And it also spreads the risk because the money is publicly managed and pooled together. On the other hand, 530 accounts are managed by the individual, most likely the parent or guardian, and then And this creates barriers for families that don't have the know-how of investing and managing the funds. There's also higher risk associated with privately managed accounts that can face more volatility and have unknown or hidden fees that can erode the account funds. And then lastly, the Washington Future Fund has automatic enrollment built into it. So this removes the barriers to access and results in much higher participation rates, which maximizes the support of the program. On the other hand, 530A accounts don't have automatic enrollment. So families must file a tax form with the IRS or set up an account online. Research shows that lower income families are less likely to participate in opt-in programs. So this means ultimately that wealthier families will benefit more because they can navigate the complex tax filing process. So in conclusion, advocates, policymakers, and philanthropists who want to create equitable wealth building opportunities in our state should focus on making the Washington Future Fund a reality. Thank you. I'll pass it back to Rachel.
Thank you so much, Tracy. I feel like we have a very, very solid foundation to walk out on. And you have the delight right now of doing a little speed dating exercise with all of these authors and experts. We are going to ask each of you to take 1 minute to say, with all the knowledge that you have, why are you so passionate and committed to advocating for baby bonds? And I'm just gonna randomly start where my where your squares are with Josie. Josie, why are you so committed to baby?
Um, I, I work as a psychologist and I worked for 13 years in VA hospital settings in outpatient substance use. That's what got me interested in all these progressive policies because I really started feeling like there's like this safety net that has these giant holes, and every year it felt like the holes were just getting bigger and bigger, and people were coming into our clinic with all these needs. And it's like, well, do I help them with their mental health, or should I help them fill out the social security application, because I feel like that's actually maybe going to help them with their mental health, right? So these feeling like there's got to be some policy solutions to that. One thing I think about baby bonds, working with veterans, I think about like, and not, I mean, a lot of people choose to join the military for really pro-social reasons and to help their community, to help their country. And there's a lot of people who join for economic reasons because they've got enlistment bonus or the promise to go to college and have that be affordable. And so I'm just thinking, what would that be like to be 18 and like you have your choices broadened out, like where you have this nest egg that now this doesn't have to feel like a pressured choice, but this can actually feel like one choice among many. And you actually get to decide for your own reasons rather than for like economic reasons.
Thank you, Josie. That was excellent. I'm gonna go to Magellan. Why are you so committed to advocating, writing, studying,
Yeah,
working on this issue, and getting 2 degrees, by the way, at the
yes.
same time?
Yeah, so I'm interested in this because I work with a lot of families and children, and I plan to be a early intervention licensed social worker one day, working with children with neurodevelopmental conditions. And I have seen a lot of things. I used to work in housing as well as like acute behavioral health with children and families. And I saw all of these downstream effects where, I'm there talking with them about their mental health, but they could really benefit from economic I just being in a better economic situation. And I think having something like baby bonds could be a really great investment in um our futures and the children, like the futures of the children who will shape our world, shape our state. And I just think that there is a lot that could be learned from it. There's a lot of education that we could leverage there, as well as it would improve many lives and also To bring it back to my section in the paper, it could improve the racial wealth gap as well.
Beautiful. Thank you. I did not know all of that long history of what you do. Amazing. I'm going to go to you, Gleb.
Yeah, I appreciate you asking this. I feel like simply put, I want my patients to be able to thrive and not just survive. I run into a situation too often every single day when I'm in clinic where I have patients who are having to make the decision between either interventions or behaviors or medications versus like fundamental like life costs that they need to like put their like entire paycheck into. I fundamentally believe, as someone who works in like a business that is very focused on like evidence-based practice, that addressing wealth is like one of the most effective downstream actions that we as a society can take. And I strongly believe that like baby bonds could be an excellent way to do that. Um, yeah, that's pretty much it.
Thank you so much. You give us a really good view of sitting in your clinic and being with people in hard decisions.
I'm in
I
my
see
clinic
Tracy.
right now.
Okay. Thank you for joining us. I see you, Tracy. Why are you so committed to this?
Yeah, thanks. I think the moment I heard about baby bonds, it just made so much sense. And I think about the hope and opportunity that it brings to young people. I wasn't born in Washington, but if I was and we had a baby bonds program, I would have been eligible for it. And I can really think about the ways that it would have changed my life. And also for just the people around me. So I think baby bonds is not just about one baby, but that whole family and community and network that they're part of. It I think the wealth building opportunity and wealth that it could bring is just to open doors to so many other things, right? Like just freedom, like security, peace of mind. And so that's really what excites me about it. And also just it aligns with my values of like economic and racial justice. And I really see baby bonds as a critical component of that if we're really like serious about economic and racial justice.
Thank you so much. When you just said you would be one of those babies, I saw you as a little one and I have a huge lump in my throat. Thank you for sharing that. And last but certainly not least, David.
Well, I love babies. Babies are so cool. Who doesn't love babies? So we should do everything we can so they can, not only get off to a good start, but have a great life. And I'm partly motivated by my growing up in that small, Pennsylvania town, 2,000 people, that was thriving until it wasn't. That we had one factory in town, a glass manufacturer, and as a teenager, I didn't really appreciate the effect that that plant closing had just not on the local economy, but on families. And so I think a lot about agency and power and what having resources can do to allow choices and freedom and flexibility to have options. And who knows, maybe baby bonds would not have made the kind of difference that, sort of a macro economic issue like a plant closing could have had, but I feel like it could. And that, there will be shocks. There are shocks happening now. And imagine, I think Tracy you sort of teed this up. If we had done baby bonds in Washington State 20 years ago, young people coming of age today, wouldn't they be in a better position to weather the current economic calamity, to have more freedom and choices, and to feel less pressure with affordability that wealthier folks are less stressed out about? So, yeah.
Thank you so much. That was beautiful, you all. I do have more questions for you, and I'm going to ask if you can keep it a little bit short enough so we have some time for your audience to ask you questions. But these are pretty great. My first question goes back to you, David. Why and how can we push for baby bonds when the economic benefits won't be realized for years at a time when so many are struggling? Maybe you just answered that question.
Yeah, well,
How
two
do
big
you
things.
balance people
Yeah,
saying, what about right now?
yeah. Let's do it all. Like, I mean, we shouldn't have to choose because families, don't divide their lives into these different agencies or programs. How do we do it all so that, we can have people be prosperous and hopeful and self-directed and so forth. And I would say to that, if we are only ever focused in the refrigerator, like helping people get by, we will only ever be focused on the refrigerator. So if we want to interrupt these cycles of poverty and inheritance insecurity, something like baby bonds seems like really important so that we can, focus on some of the bigger picture things to help people be free.
Whoa, whoa, whoa. Every family deserves a fridge, but every family deserves a pantry. Tracy, how do baby bonds fit into other policies that propose to address racial and economic justice?
Thanks, Rachel. I think David mentioned this, but like baby bonds is not a silver bullet. It wasn't designed to be. So I think that is it's a really great complement to all of the other policies, programs that we have in place, and then policy proposals. Budget and Policy Center is working on a number of things like I work on working families tax credit and guaranteed income. Working families tax credit has already been implemented, so we can see the impact that it's making for people who are struggling to meet their financial needs. And guaranteed income, I hope, is something that we can bring to our state. And provide people with unrestricted, unconditional cash. We also are doing work in our state around immigrant inclusion, making sure that immigrants in our state who are contributing billions of dollars in taxes are also be able to enjoy the public benefits like unemployment insurance and healthcare. We also are part of a statewide coalition to end legal financial obligations. Which are which include fines and fees that are imposed by through the legal system. And this is a very extractive policy that disproportionately impacts Black and Brown people. Um, I could list a lot more, so I'm going to keep it short.
Thank you so much. And that tied in really well about freedom, that some of those policies are actually ways of making people economic slaves. The next question goes to Magellan. Magellan, how could baby bonds shape health across the life course, particularly for Black families and other communities that have historically faced structural barriers to wealth and to health?
I think that it could do a lot. I like how Tracy said that, baby bonds isn't a silver bullet. However, I do see it as being pretty key in establishing the more security and economic stability for Black and Brown families more explicitly, and low income families as well. But I just see it as linked. Um, I also think that um, it will allow for families to have to start off, or babies who could be born onto baby bonds, to start off, just have a better start to life. Um, and uh, yeah, I just think that it could also expand access to resources, as well as opportunity later in life, for Black and Brown people. So that's what I think.
Thank you so much. I've been an anthropologist for 35 years, and I can tell you one universal is there. I have not come across any society through history, place, and time that does not dream of a better future for their young ones. Nowhere in the world. So thank you for that. The next question goes to Tracy, and it's about hope. Sorry, Josie. You mentioned hope as a variable in the relationship between baby bonds and mental health. Can you share more about the role of hope?
Yeah, thank you. I, yeah, I was interested in that piece too, because it seemed like it came up across the studies, like not always and not universally, but like especially for, the lowest income of folks or the folks with the most mental health symptoms, like vulnerable populations really like these studies show like the hope really increased with these child savings accounts. And the way they measure it's like, can you get out of a jam? Do you have options? But also like, yeah, do you imagine yourself having a better future like you're saying, Rachel? And are things, is tomorrow going to be better than today, basically? I don't think it's a surprise. And I think like, especially I'm thinking about the timing now where like, young people, there's a lot of hopelessness. Like when they're looking at the economy, looking at AI, looking at the affordability of how a house or college, like there's just a lot of hopelessness. And I don't know if y'all feel it in the air, but I feel it in the air. And policy stuff matters. Like folks that, of the boomer generation, like there was a lot of policies there to help make it affordable for housing and college and things like that. So how powerful that is just to know like, hey, I've got this nest egg, I've got this thing, and maybe I can actually think about starting a business, or I can think about owning a home, or having a better life, having children, like all these things that come with wealth start to become possible. And like that pulls you out of that depression, it pulls you into a more yeah, like a more psychologically healthy place.
Thank you. Hope is medicine. Sounds like good medicine. There's one more question for you, Gleb. How confident can we be that wealth itself is causing these health differences?
Like health differences?
How confident can we be, it's sort of building off of what everyone else has said, that it is wealth itself and the absence of wealth that is causing these health differences? Maybe it's just people's
Yeah,
biology or their lifestyle, or why are we confident that
yeah.
wealth matters?
Yeah, I get a variation of this question for like a lot of other like wealth related advocacy work that I've been partaken in. And specifically when it comes to baby bonds, like while observational studies can't prove causality perfectly, the evidence is unusually strong and consistent across multiple methods measuring wealth versus health. And I'd strongly recommend folks check out the white paper specifically for this. But in a gist, like we see the same patterns when it comes to longitudinal data, twin and sibling studies, hazard ratio analyses that adjust for education, income, as well as known risk factors. Um, there's a twin study in particular that's mentioned in the white paper because it's really compelling because it controls for genetics and early life environment, and still finds that differences in wealth accumulation predict differences in longevity. So while no single study is definitive, the convergence of evidence strongly supports, a causal relationship. And that's coming from someone who, like I said before, like my entire life practice depends on like evidence-based like best evidence practice. So very passionate about the evidence here.
Thank you so much. Sometimes I have a feeling that the people asking those questions have wealth. Like, that just is a sense I have. We have one beautiful question in the chat, and I think there were two questions actually. I'm going to go to the one that may not have been covered in our discussion. And if we have time, there's a question about that someone wants to answer it about Indigenous, the impact of monthly stipends to Indigenous community members. You could direct people to where that is in the white paper. But I'm going to go to a question from James Pfeiffer. And James asks, how do we ensure that baby bonds will not be used by the right to distract from strengthening and funding public daycare, schools, health, and affordable housing? Kind of, I guess, like vouchers. Let's give everyone vouchers, but not make schools across the board better. And that's open to anybody. David, I see you're off.
I could do a quick dive there. So, I mean that's a risk for sure. In fact, the 538 counts, some suggest that it borrows the language and intentions of baby bonds, but doesn't do it in a way that's going to have the effect. So it takes a good idea and makes it worse, essentially. That said, there's an opportunity. The right is talking about wealth in America, and that the government has a role in doing something about it. And how we get there matters. To me, the future fund is like the more durable, elegant, impactful way. So if there is a bipartisan conversation to be had, it feels like there might be a more open door or window or whatever thing that we look through that might be able to drive conversation forward in a way that's doesn't make it a zero-sum Hunger Games sort of thing, because we don't want to do a strong baby bond and then have, childcare eviscerated or healthcare more expensive and less accessible, all those things.
Thank you so much, and especially for the Hunger Games metaphor, which is very, very visceral for lots of people. Are there any questions from the audience? I feel like that was a great answer. If anyone else wanted to jump in, um,
I can add to that.
yes, please.
I think one of the main ways that we can kind of fend off that pitting against each other is to build a bigger and stronger coalition, right? We need to build um, partnerships with our childcare providers, with educators, with healthcare advocates, with housing advocates. And we actually do have that in our Baby Bonds Coalition, our Washington Future Fund Coalition. And so we talk amongst ourselves first, right? And we build that platform. And when we talk to legislators, we don't get pitted against each other because we are all supporting the same thing. And I see that not just with baby bonds, but in the other work that I do in direct cash with guaranteed income as well. It's very easy for legislators to ask, well, do you want this or do you want that, right? Do you want guaranteed income or do you want working families tax credit? And that's why we actually combined our two coalitions so that we wouldn't get pitted against each other. And so, yeah, just going back to building the bigger tent, like David said.
Building the bigger tent. You're not your brother's keeper. You are your brother. And if your brother's in the room, no one can separate you and tell you things about the other that aren't happening. Beautiful, beautiful. We have a few minutes before we close this up to hear your questions and would love to hear your voices. I'm not running this Zoom, but I'm imagining you could put your hand up and Anya would either unsilence you or you unsilence yourself, or just to give love to this brilliant panel that it's been such an honor. Questions? No more questions. Just getting applause. Oh, James, there's a
Oh,
raised
just a
hand.
quick comment to thank everybody and especially the writers of the white paper, which is really such a great document and well researched. And thanks to everyone for doing this critical work.
If there are no questions, I will hand it to Anya to talk about action. And once again, thank you, everybody. That was amazing, and I'm glad it was filmed. Lots of people need to see it.
Yeah.
Anya, are you there?
Yeah, thank you so much, Rachel, for being an amazing moderator and for all of the speakers. That was a really engaging and helpful discussion for me, and I hope everyone else on the call. So, to close, we have just a few actions for you. We would be so appreciative and grateful if you could please distribute the white paper in your networks to whoever you think would benefit from reading it, whether they are in health fields or outside, just anyone that you think might be up for joining us in this fight to have baby bonds in Washington or could learn more about how wealth building could improve health and close racial wealth gaps. We also have a quick few questions survey for you, which we are hoping that you can take. And there's also the opportunity there to enter in any outstanding questions you might have for speakers, and we can definitely connect you with them to get those answered. And also a way to opt in if you would like to stay in the loop of the advocacy and work ahead for getting baby bonds legislation passed here in Washington. And lastly, you can always subscribe to emails from WPSR, and that's a great way to also stay tuned for actions, and I will drop that link as well. So yeah, with that, thank you. I will drop these links as well. We are so grateful that you all chose to share space with us tonight, and hear from all of our lovely speakers. To the speakers, thank you so much for being here. Your expertise and your passion around baby bonds is so appreciated. So thank you, everyone. Any last words, Rachel?
Anya, if you can take down the slide for just a second and drop this information. Everyone in other parts of the world, people come off mute and make noise for the speaker. So come off mute, come on camera if you can, but just raise a voice. Woo, woo,
Good
woo.
job.
Yay!
Yay!
Great job. Thank
Nice.
you.
Nice job, everybody. Beautiful. And don't miss Charles' comment that if you want this talk to come to your organization, let WPSR know.
Please, please. See y'all. Thanks. Have a great night.
Thank you, everybody. Have a great night.
Thanks, everyone. Bye.